So I think one of the most overlooked tools in public health is, well, the Joint Strategic Needs Assessment, or JSNA, right?
Absolutely. It's like the backbone of understanding community health, connecting the dots between socio-economic factors and health outcomes. Without it, policymakers would be flying blind.
And what I find fascinating is how it doesn't just look at, medical data, but really dives into things like housing, education, and even social isolation.
Exactly. For instance, there's this case in Surrey where JSNA data revealed a glaring gap in healthcare access for a specific underserved demographic. By identifying the root causes, like transport barriers and a lack of bilingual providers, an intervention was designed to bring mobile clinics into those areas. Lives were changed.
Wait, mobile clinics?
Yes, mobile clinics. They were staffed with healthcare workers who not only provided treatment, but also collaborated with local communities to address broader concerns, such as nutrition and preventive care. And it worked. Health outcomes in that demographic improved significantly.
That's incredible, really. It's almost like designing a good website. Sure, you tackle the main issue, but you also have to think about the user experience. It's all connected.
Brilliant analogy, Oliver. In the end, it's about integration. The best outcomes come from a cohesive, person-centered approach where health and social services work hand in hand. Think of delivering care as building bridges that connect all the facets of a person's needs. It's holistic and, quite frankly, essential.
And it feels like the JSNA is, it's the blueprint for building those bridges, wouldn't you say?
Precisely. Without such a foundation, efforts would remain fragmented and potentially ineffective. But with the JSNA, we're seeing the dots joined in ways that make real, tangible impacts on people's lives.
So, thinking about those mobile clinics and the bridges they built, it really brings to mind the Recovery Action Group Surrey. Eleanor, they seem to embody something we've touched on, co-production. Why does that matter so much in recovery work?
It's pivotal, Oliver. Co-production ensures that people with lived experiences are at the heart of designing these services. After all, who better to point out what truly works than those who've walked through those very challenges?
Right. And it kind of flips the traditional top-down approach on its head, doesn't it?
Exactly. Take multiple disadvantages, for instance. Whether it's homelessness, mental health struggles, or addiction, they're rarely isolated problems. They interact, creating a complex web that mainstream services struggle to untangle.
It's like fixing one part of the web isn't enough, because everything else is still tangled.
Precisely. What the Recovery Action Group Surrey does so well is addressing these complexities through community engagement. They bring people together, those with lived experiences and service providers, to collaboratively find solutions. It's not charity, it's partnership.
That's such a powerful shift. And it's not new, is it?
No, it's not. Historically, we've seen similar efforts like the settlement houses in the late 19th century. They tackled poverty, education, and health in urban communities by directly involving residents in shaping solutions. What's striking is how timeless this approach is. It's all about empowering communities from within.
So the Recovery Action Group is like a modern version of those efforts?
In many ways, yes. They've brought that ethos into contemporary recovery work. And by breaking down these silos, say between mental health support and housing services, they're creating something truly holistic. It's life-changing for the people they help.
And dismantling those barriers it's not just about service efficiency, right? It's about restoring dignity too.
Absolutely, Oliver. It's about recognizing humanity in each person, seeing them not as problems to be solved, but as individuals with strengths, stories, and contributions. That shift changes everything.
Eleanor, after all this talk about co-production and breaking down silos, it makes me wonder, what about the legislative side of things? How much do the rules and policies behind these initiatives shape what's possible in recovery work?
Oh, immensely, Oliver. The JSNA, for instance, isn't just a tool, it's a statutory requirement. Local authorities are obligated to assess and meet the health and social care needs of their communities. But here's the catch. These policies only work if they're fueled by genuine grassroots insights from the people they aim to serve.
Right? So without that community input, It's kind of like building a house without consulting the people who are going to live in it.
Exactly. And when policies are shaped authentically, when community voices are truly heard, the impact can be profound. Take the Recovery Action Group Surrey. Their work demonstrates how local input can literally transform services.
Can you give us an example? I mean, something that really illustrates what you're talking about?
Of course. There's a story that comes to mind. A participant named Lisa. She had faced, oh you name it, multiple disadvantages. Homelessness, substance use, and mental health struggles. For years, she fell through the cracks of fragmented services.
That's heartbreaking, but unfortunately, not uncommon.
Exactly. But Lisa's journey took a remarkable turn when she joined the Recovery Action Group. Through co-production, she and others worked alongside service providers to redesign housing support systems. Lisa contributed her insights, what had failed her and what could succeed. Over time, this collaboration led to the creation of transitional housing that combines mental health support and job training.
And that kind of co-designed solution, it sounds like it not only helped Lisa, but also filled a gap for others in similar situations.
Precisely. What's powerful here is how Lisa's lived experience wasn't just used to fix her own plight, but to build a bridge for others. Today, that transitional housing model is thriving, offering stability and dignity to so many.
It's like a ripple effect. One person's story leads to change that helps an entire community.
Exactly, Oliver. And Lisa herself has said it best. She no longer feels defined by her struggles, but by her contributions. That's the essence of what community-driven innovation can achieve.
That's inspiring. And honestly, I think it's a call to action for all of us to engage more deeply in these systems.
Absolutely. Because when we listen, truly listen, and collaborate, we create health and social care systems that don't just support survival, but foster flourishing. It's a future worth striving for.
And on that note, I think we've reached the end of today's discussion. It's been incredible diving into all of this with you, Eleanor.
Likewise, Oliver. To everyone listening, let's carry these lessons forward. Together, we can shape a future that leaves no one behind.
And that's all for today. Thanks for tuning in.